Hi, everyone. This is Jill Swartz from Specialty Med Training, and I am delighted to be with Lamia Gabal. She is the Chief Medical Officer and owner and operator of Prestige Medical Group in California. Hi, Dr. Gabal.
Hi, Jill.
Thank you so much for joining us again. This is one of many educational seminars or webinars actually that we're doing. They're kind of educational pieces for Dr. Gabal's patients and soon to be patients that are really kind of talking more in depth about the solutions in the field of sexual health and wellness for her male and female patients. And today specifically, we are going to hone in on the men. Last week we did one on women, but this week we're going to talk about sexual dysfunction in men, and primarily for one regenerative therapy called platelet-rich plasma, PRP, and the P-Shot, and how it is used to treat men. So Dr. Gabal, I'm going to let you take it away and share with us all your incredible knowledge on this this condition, which is very wide, right? And we see lots of info on male sexual dysfunction.
Yes. So thank you, Jill. Thank you so much for having me. I'm excited to share information on this. You know, I'm a board certified urologist, and we really are the experts in treating sexual dysfunction in men. We know that this is a very common condition, and one in which came to the forefront really about 25 years ago when Pfizer accidentally came up with Viagra. I don't know if many of you know, but that medicine was actually found by accident. It was being studied for hypertension, for blood pressure. The study participants did not want to give back their medications at the end of the study. And it turns out it was because it had this wonderful side effect of helping restore blood flow to the penis. And so it really helped us, I think, to understand male sexual dysfunction better. And more importantly, I think, to be able to talk about it more, because before that, and I remember in training, you know, we didn't have an option to talk to our patients about. And I remember telling men, oh, it's in your head, you know, there's nothing we can do about it. And yes, the brain is the biggest sexual organ that we have, but now we are learning so much more about what we can do for treating erectile dysfunction. And now 25 years later, we have come up with even better therapies than what was introduced 25 years ago, because not only are we able to treat erectile dysfunction, but we're able to reverse it. And that's, I think, what's most exciting. If you look at these numbers, over half of men really suffer from erectile dysfunction. It's such a common disorder. And unfortunately, men of every age feel uncomfortable still talking to their providers about it. But it's just something we really want to bring to the forefront and make people comfortable talking about.
Wow, that's very interesting. And that is a fun fact. I did not know that about Viagra. And I bet none of your listeners, or very few of your listeners knew that. That's very interesting. And there's a lot of different solutions out there with this increase of awareness and even really in the science of medicine in the regenerative field. But we kind of specifically wanted to touch on, and maybe you can tell on a whole, maybe just mention quite a few. We're going to speak specifically to platelet-rich plasma, but there are a bunch of different therapies out there for men.
For sure. So, you know, erectile dysfunction, let's first talk about having an erection. To have a normal erection, there needs to be many connections that are normal. You need to have good blood flow to the penis. The nerve endings to the penis need to be intact, and then you have to have blood flow that doesn't leave the penis. And so there's several different things that are going on at the same time in order for a man to achieve and maintain 100% of an erection. And that can be disrupted because of many different things. High blood pressure, diabetes, high cholesterol. Also, the medications for a lot of these conditions can affect blood flow to the penis. Smoking is a huge risk factor because it clots off your arteries everywhere, but especially to the penis. And as we age, we get total body inflammation, and that increases cardiovascular disease and also increases the risk for erectile dysfunction. So we know that as men get older, the chance for erectile dysfunction increases, but it happens even in men as young as in their 20s. And really people don't know about the different therapies that are available in order to be able to restore blood flow to the penis. And not just blood flow, but nerve endings, collagen, elastin. These are the things that we're trying to rebuild and restore. And so what we're talking about today is a very exciting restorative therapy called PRP, or platelet-rich plasma. A colleague, his name is Dr. Reynolds, Charles Reynolds, he developed the use of PRP for sexual medicine. In women, it's the O shot. In men, it's the P shot, or the Priapus shot. And really brilliant on his part to take this technology that's been around for years, for many years, and to really apply it to the area that we're trying to restore. It's been used for many years in orthopedic applications, and then now in using it for sexual function, it's really been so helpful. And what we're doing is we're taking blood from your own arm, and we are spinning it down to a much smaller amount where we remove the cells that we don't want, and we are concentrating these exosomes, these alpha granules, these regenerative tissues that really we're now delivering to the area that we want to regenerate. And we're taking advantage of the healing factors from your own blood and injecting it back to where we want it. So super exciting. It's been shown to help regenerate collagen, elastin, nerve endings, very safe, because it's your own tissue, very effective. And quite frankly, it's more effective the sooner you start, because, if you've gone many years without an erection, it's more difficult to regenerate those tissues. The tissues have already undergone much change that might be more difficult to reverse. Works much better in younger men who already are suffering from a small amount of erectile dysfunction, but we are now able to get them back 5 or 10 years, to get them off of their medications, or a lower dose of their medications, or they need their meds less often. So,
and I think that's something that I'm learning doing these interviews with you, is it really the whole preventive side. I think we do wait. You're speaking specifically to men, but even though it's women, but we tend to wait until we have a problem to address it. I loved learning this about PRP, not only because it's so safe and it's using your own blood, but that it truly does have a preventive mechanism into these aging conditions.
Absolutely. And again, I tell the story where I had an 80-year-old gentleman who came in with now his 50-year-old girlfriend, and he hadn't had an erection, in almost 20 years, and now is hoping for me to restore it. Well, I told him it's impossible at this point, because the cells themselves have closed down. The blood vessels are constricted to the point where we're unable to regenerate that tissue. But the sooner that you start where there's only minimal dysfunction or even no dysfunction, it really can help to extend the longevity of the function of those tissues. We see that also if you talk about Botox in the face. Someone who has a very deep line already from years and years of scowling, we're not going to be able to do that with Botox or affect it. But when you see that Botox is now being used in 20-somethings to actually prevent the lines that might happen later in life, I think that's a good analogy, because
that's a great analogy. Yeah, we can definitely, that's something tangible to think about for sure. So tell us a little bit, if you will, we're address the safety and the benefits here. Tell us a little bit about the procedure itself, because when you think about PRP and a needle and the peanut, like all of that. So I know your listeners have a bunch of questions with that. We love what it can do, but tell me a little bit more about how the procedure is done for your listeners.
Yeah. So when I explain this, I know there's lots of questions that my patients do have. And, we're taking the blood from your arm, not from anywhere else. and it's about 60 cc's of blood, about 2 ounces. We spin it down to about 10 cc's, so it's less than half an ounce of the platelet-rich plasma, which are those healing factors, those wonderful platelets and stem cells and exosomes that we're gonna now inject directly into the area that we want to heal. So yes, it does involve a very tiny needle into the shaft of the penis, not into the head. That's another question that my patients will have. The head is much more sensitive and probably more uncomfortable if we were to inject there. So we do 2 injections, 1 on each side of the penis into the shaft. After putting a topical numbing cream on the skin, it is very well tolerated, very minimal discomfort. In fact, you know, we have some men who have to give themselves injections every time before they have an erection with a needle that is actually bigger than the one I use to inject the PRP. So that just speaks to how well tolerated this treatment is. If a man can do it for himself with a bigger needle at home, and this is what we're trying to prevent for our other patients. We don't want you to get to that point where that's the only treatment option that's available to you is an injection every time you want to have sex. We're trying to do 1 injection, possibly a series over the course of a few months in order to really restore your natural younger tissue so that you have more natural, longer lasting erections. It takes a few minutes. There's no downtime. You can go home and use your penis as soon as we've injected you. There's really no downtime. And again, it can help with actually girth and length of the penis. That's been shown to help. And it actually definitely helps to decrease the need for medications and possibly even get you off of the medication.
Yeah,
it
so
really
I think
helps to restore tissue.
yeah, great. To emphasize that it's a very quick and painless procedure. There is a post protocol though, that's something that they do at home that involves pumping.
It is helpful to use a vacuum device twice a day because that really does help to bring more blood flow to the penis in order to enhance the healing. All healing is dependent upon blood flow, and that is why some diabetics may not get as good of a healing in their ankle or their foot if they have an ulcer. It's all related to blood flow. But PRP really has been used even in that indication where they're getting the healing factors directly to those non-healing wounds, and it's been shown to help better for wound healing. We're doing the same thing in the penis. We're getting those healing factors directly to where there may be an issue with blood flow, but then we want you to increase that blood flow with the vacuum device twice a day so that we maintain the healing process and really stimulate those cells to regenerate.
Yeah, and I think it's really important to emphasize again what I'm learning in this is that we don't have to wait till we have a serious problem. In fact, this can really help anything from getting any worse, and that it truly is very a quick and painless procedure. This is something that all men should truly consider. I can't imagine anyone that wouldn't benefit from this, other than, as you said, perhaps someone who's smoking or not
Yes.
healthy in a healthy state in the first place.
Yes, I think smoking, if someone's a current smoker, that would be a reason not to try this. I just wouldn't want to waste their time and energy and to be disappointed, because smoking really does affect all kinds of healing. But it definitely has a very high success rate depending on where we're starting out, depending on your own health and other medical conditions. But it's 100% safe, 100% drug-free. There's no side effects, no downtime, and really has been proven to be effective.
Awesome. Well, again, thank you so much for your time. Please let your listeners know where and how they can learn more about getting this procedure done. Oh, and before you do that, so is it 1 shot, 2 shot, 3 shot? Tell me a little bit about that for your listeners.
Yeah, so it works best as a series, and you may get benefit with 1 shot, but really works better if there's 2 or 3 sessions in succession. And it even works better combined with other therapies, which we'll address in future talks. But you can combine this with stem cells. You can combine it with acoustic waves for ED, and that really has been shown also to help stimulate cell growth and tissue regeneration even further. So
and that's
so
what's great about great about Prestige Medical Group as well, and working with a practitioner like Dr. Gabal and your practice. You are on the cusp or the cutting edge of all of these different regenerative therapies. So it's not just a one and done. You have an array of tools that you offer your patients, and I think that's what's very meaningful when people are looking for a solution, because it's never just maybe one fix. And it's important to work with the doctor.
I get super excited about all this regenerative stuff. We're so lucky to live in this day and age where we're able to offer it. And, I'm learning about it for myself, for my family members, but also so excited to be able to offer it to my patients as well.
Absolutely. So tell your listeners how we can get signed up.
Yes, please. You're welcome to check us out online at Prestige Medi Group. That's MEDI group.com. You can look up my name, Dr. Gabal, DRGABAL, or you can call my wonderful patient care coordinator, Teresa. She's happy to help you through this journey. And her direct line is 949-387-0411.
Awesome. Thank you again, Dr. Gabal, and everyone. All your
Absolutely.
listeners, stay tuned, because we will be hosting quite a few more of these types of programming in the near future. Thanks again.
Thank you, Jill. Thank you for having me.
You're welcome. Bye-bye.